A very good evening and welcome, viewer of SSBC. This is Sundown Beam coming to you live on SSBC. This is where we dissect the issues that matter to you. Sundown Beam is the SSBC's evening flagship program where we shed light on stories shaping our nation and the world. We dive into current affairs, politics, social challenges, and community voices, bringing complexity to clarity. And this evening, it is another wonderful episode on Sunday. On Thursday, with me, Peter Majak, your host. As we dive into the program, remember we will have chat with the guest and we will have motivation at the end. And we are live on our Facebook page, SSBC TV, and YouTube, SSBC Official. All these platforms are here for you to share with us and get to learn on all the topics and all the programs that come to you on SSBC. As we will be going for a short break, this is Sundown Beam where we dissect the issues that matter to you. And this evening, one issue that matters to you is what is the future of South Sudan Surgical Association or surgical unit when it comes to medicine? You have doctors in many hospitals, but surgical unit is one of the units that is vital because in a room where a human being is locked into a theater, the hope shifts to depends on only two, God and one human being. Who is that human being? We are talking about the surgeons. So this evening, we will be joined by surgeons, members of South Sudan Surgeon Association, and we will get to know them by names when the time comes. First, let's go for a break, and when we come back, we will dive into the conference, the scientific conference that is on the way, and you will get more details. Let's go for a short break, and we'll be back shortly. Welcome back from that short break. If you have just tuned in, this is Sundown Beam, and we have just gone on, and you will still have a lot to catch up with this program. This is where we shed light on the stories that shapes our nation and the world, and we dissect the issues that are of the most importance to you. And one of those issues, viewer, is the surgical future of South Sudan when it comes to, medicines. What is the future of South Sudan Surgical Unit? Well, to dissect that issue, I am joined by Dr. Gift Natana, the Vice President for the Association of Surgeons of South Sudan, ASSUS. And I'm equally joined by Peter Thomas, the Secretary for Academic Affairs, Associations of Surgeons of South Sudan. This evening, we will talk about the future of surgical unit or department, whatever you call it, in South Sudan. Welcome, it is my pleasure to have you.
Thank you, Peter,
Yes.
and all the viewers of SSBC.
Thank you. Thank you, Dr. Natana, and thank you, Dr. Thomas, for joining us. I think this is the first time, and it is not going to be the last. We will have a lot to share. Well, talking about the Association of Surgeons of South Sudan, ASSUS, it will be good to take us to the background before we delve into what this association is all about and what are the visions of this association. So kindly, as the Vice President of the association and the Secretary for Academic Affairs, take us through the initial background of what came to be known as the Association of Surgeons of South Sudan. Welcome, Dr. Gift.
Thank you, and I welcome also the viewers of SSBC to this important episode of Sundown, which is going to tackle the issues of surgical practice in South Sudan. In this regard, I will start by briefly giving the background for the association. The Association of Surgeons of South Sudan, that is abbreviated as ASSUS, is a professional body that was formed in the year 2017. All the surgeons from these different disciplines, because when we are saying surgeons in South Sudan currently, in this association we have different disciplines within the surgical practice. So they came together, the South Sudanese surgeons came together in the year 2017, especially on day 25th of September 2017. They came together and deliberated on the importance of forming an association that will join together all the surgical professionals and bring them in under one body. So this association was formed in 2017, and from that time it has started working. It brings together surgeons from these different disciplines, as I've said. General surgeons are there, ophthalmic surgeons are there, ENT surgeons are there, obstetrics and gynecology surgeons are there, orthopedic surgeons are there, maxillofacial surgeons are there, and all the other neurosurgeons, although currently we don't have, but all of them are covered under the umbrella of ASOS.
Good. Those breakdowns are very important, and we will get to know them better in the conversation. Welcome, Dr. Peter Thomas. If you have anything to add about the background of ASOS, welcome.
Yeah, thank you so much for your hosting us, and we thank your viewers for listening to us this evening. My colleague has already stated the background about ASOS, or the Association of Surgeons of South Sudan. And like he said, it was founded in 2017. However, we were elected into this office in November 2023. The association is mainly seeking to advance surgical excellence in South Sudan, and to bring all the surgeons together to serve the South Sudanese communities. ASOS as well has its own organs. We have the executive committee being headed by the president and the vice president, and then there is a secretary general, secretary for academic affairs, the office that I hold, and I have a deputy as well, and then we have secretary for finance and a deputy. Usually we get elected into office by the General Assembly. So from tomorrow, ASOS is hosting its first ever scientific conference, and it will end hopefully on Sunday with an annual general meeting, with the hope that we'll have a new executive committee that will take the association forward. Thank you.
Thank you, Dr. Thomas. And talking about the background, we will need to establish here, like when you brought the surgeons together, what is the statistic of South Sudanese surgeons currently? That one is very important, because when you see cases that need surgeons in South Sudan, everywhere in the states, in the administrative areas, so there are cases that need surgeons, and at the end of the day you find you have a shortage of these personnel. So what is the current statistic, if you may have the statistic of South Sudanese surgeons?
Yeah, currently the number of South Sudanese surgeons within the boundaries of South Sudan are above like 110 or 15. These are South Sudanese surgeons within the boundaries of South Sudan in the different cities of South Sudan, but mostly concentrated in Juba. But there are other areas all over the country. You find that there is one or two that are there.
Wow. It's really challenging, Doctor, when you look at the population of South Sudan and you divide this number of surgeons. Actually, I had a chance to visit your website, and what I found there was like 111. That is the records, and despite the fact that there might be other people who might have graduated of recent, but less than 150 surgeons for South Sudan. Dr. Thomas, how is that one really? How possible can the surgical unit be covered by this number of personnel?
I must be honest with you that the needs of our country needs more masses of specialist doctors that needs to be produced. But we should be also proud as a country that over the last 15 years, the country has managed to inject such a number into our healthcare system. But out of those 110 plus that you have mentioned and have seen on our website, covering all the surgical specialties, we have a good number of females, and it's something that we are proud of. We do encourage our authorities and the South Sudanese in general to invest in health care, including training the cadres, not only training the cadres, but even advancing the skills that have acquired during their specialist training, because coming out from specialty training is not more than enough. Maintaining your skills and knowledge also is very important, and you need to keep updating yourself. That needs also resources. We need to be proud also that most of these surgeons were trained outside the country. So there are nationals coming in with international knowledge and expertise and exposure. Some of them worked outside the country, and some of them are coming back home nowadays. So the number is still little, but compared to what we had in the past and where we came from, and even compared with other countries, we must be proud of ourselves that these numbers are enough, at least, to do something in the shortest possible time in future as well. These numbers also are actually enough for us to start domesticating training within the country, because by training surgeons within the country, we are actually training at the same time, but also delivering services. When you train people outside, you are actually taking some of your doctors outside the health system, and the public will be denied of the service. So through your program, we would like to pass a message to our authorities and other people who are capable in supporting such initiatives.
Thank you, Dr. Peter. We will come to that, and actually we are going to explore a lot in this field of surgery. The fact is that the number is really alarming. Comparing to evaluating the cases and the coverage, the area that South Sudanese have spreaded all over South Sudan, and you distribute this number of surgeons, is really we are lacking, and there's nothing we can do about that now. But as we go, Dr. Gift, coming with the associations of surgeons of South Sudan, there might be objectives that you want to achieve, and there must be a vision. So what led into creation, what inspired the creation of the associations of surgeons of South Sudan, ASOS? What brought that idea, and what were you trying to address by coming together?
Thank you for the question. When the doctors came together, South Sudanese doctors came together to form a body, a professional body for the surgeons in South Sudan. The purpose is, the vision of the association is to advance, surgical excellence, surgical training, and research also, in South Sudan. Whenever surgery is happening in South Sudan, it must be guided by certain standards, because as a nation, the Ministry of Health has standards for service delivery, and especially in regard to surgical services, there are standards, professional standards, which are for the nation. It should be there. Also, the region has standards, and also globally, there are certain surgical standards that are there. every surgeon must abide by this. So as we come together as South Sudanese surgeons, we want to encourage all of the professionals who are practicing within the boundaries of South Sudan to, uphold these standards so that their practice becomes, according to these standards. And so every service that is delivered must follow these standards for the excellence. So this is the vision that we are striving as a body, to achieve. What any surgery happening within South Sudan be excellent. The outcome must be excellent.
Thank you. Maybe Dr. Peter can have something to put on why coming together as surgeons. What do you want to address? He has said, and you may have something little to add.
Yeah, thank you so much. Apart from what he has mentioned, the association is actually a body not for profit. So through that association, I mean, the surgeons of South Sudan do volunteer their time as well to help the public and to help the government as well. One of the objectives of the Association of Surgeons of South Sudan is to be the other arm, okay, in supporting like Minister of Health when it comes to needing a national surgical expertise and opinion. And recently we have been working with the Ministry of Health. They will be joining us in this first scientific conference. We were meant also to work with other health institutions in the country, like the College of Surgeons and Physicians of South Sudan, which is mandated by law to oversee and spearhead postgraduate medical training in the country. We have not done it yet, okay, but one of the things that we want to do, like you have mentioned, the numbers are very few, and in future, with availability of resources and collaboration with governmental and non-governmental organizations, we'll be doing outreach activities. We may go to Rang, for example. Okay, we send a good number of surgeons to go and offer services there, or we go to Maridi and do the same as well, or we go to Raja and do the same as well. So these are some of examples of what the association can do as part of its objectives and mandate.
Thank you, Dr. Thomas. And as we move from the mission and maybe the objectives of the association, have you piloted any of those objectives? Is there something that you have tried that is helping the citizens or health beneficiaries of the surgical services? Like we have the 10 states, we have the administrative areas. As the Association of Surgeons, is there any idea, any initiative that you have brought up to see that hospitals or public health centers that are very far from the city are visited? Or what have you done so far since your association came into existence in 2017? Maybe Dr. Gift can start.
Okay, yeah, thank you. The association, when it started at this time, 2017, if you track the record or the history of the association, in 2017 there were only few even surgeons. This number, the statistics that we are telling you, this is the
the number has grown.
The number has grown, exponentially, because that time when the association started, the members were few surgeons. 2017. Okay, so now from that time until now, the number has been growing every year. Okay, and mostly because of the presence of the association, it made it possible for others to also think of going for postgraduate studies, specializing. That is why from that time it was mostly under establishment, and I can tell you this is the second executive body, because the first one was the founding members who took long to establish, and mostly they focus on, founding. So now the activities were not so obvious. They were doing internal, arrangements, internal documents, and also trying to trace the statistics, trace the professionals, and have statistics and all this. So now the second executive body, which is this one that we are in, the second executive body started in 2023, and we had plans, for the office, but also due to some issues, we were not able to fully implement every program that we are able to do, because it needs resources to go out. As he stated, one of the major areas of focus for the surgeons for the association is to reach out also to our areas which are outside, because South Sudan currently somehow service delivery is happening mostly within the capital city, Juba, but states, there are some factors that lead to, like, the services, even access or coverage. Coverage, the presence of doctors or surgeons in these areas is not, you cannot compare with the numbers inside here, for factors that are out of our hands as professionals. That is why we saw that we need to in order to cover the gap, we have to devise this issue of community outreaches, like organized outreaches to one state, like he said, so that we can at least go there and provide the services there. We try to raise, one, in the beginning of the office, we try to come with one campaign for outreach in Yambio, but we were not able to, because it entails a lot of transportation issues, also medications and all this. So we tried, but we could not succeed. But it is in the plan. So we hope that now, as the term is coming to an end, maybe this is one of the recommendations that we can be able to give to the upcoming office, to be able to carry on with this issue of community outreaches to our the states. Regarding some of the activities, because, as I said, the training is one of the major issues, that objectives that we as a association we are working with, trying to focus, like he mentioned, domestication of training inside, training of surgeons inside the country, but also trying to create corporations and agreements with bodies in the region. So this has been ongoing, and we may discuss it later on, like how the association was able to establish relationship with College of Surgeons of East and Southern Africa, COSEXA. So now this one, the relationship has already been established, and there is a kind of form of training going on locally here right now. The one center is already approved for training locally. So now, regarding service delivery in form of outreaches has not happened. We have the plan, but because of the issues of resources, we could not be able to achieve that. But there are other activities that are happening on the background.
Well, Dr. Thomas, you will come in, and one thing that has been realized is that this few number of surgeons is said to have been taken by private institutions, leaving the public hospital without surgeons. How true is that?
Thank you for that question. We have mentioned the numbers of review. And whether in our private or public capacities, surgeons of South Sudan are actually committed, to serve the population. The same surgeons that you see in private are actually in public, volunteering their time and not demanding much, and working through challenging environments, but at the same time doing their best. I'm sorry to say this live as well, because Gift got his own public capacity as a deputy DG for Juba Teaching Hospital, for example. The membership of ASOS in general are working, both in private and public. Those who are working in private are trying to put some food on the table, but they do also offer enough time, to help in public facilities and other related institutions like teaching in medical schools, being part of advising the Minister of Health, working with some international NGOs and UN entities, through offering consultancy. So surgeons are actually helping a lot, but most of these things are not seen or heard, maybe because we don't like talking too much. But behind the scenes, we are doing a lot of work. Thank you.
You are talking now. All right, Dr. Thomas. Coupled to that, you are the Secretary for Academic Affairs, and we will not leave this interview without telling the viewer what do you do as a Secretary for Academics in the Surgeons Association.
Yeah, thank you so much for that question. I'm part of the executive committee in charge of academic affairs. I have a deputy secretary as well, so we oversee the academic activities from training, education, research, reviewing the guidelines and protocols, helping setting standards, like he mentioned previously, but most importantly, conducting academic activities like the conference that we are hosting tomorrow, forging collaborations, also academic collaborations with similar entities by attending external conferences, whether regionally or internationally. Through these activities, our interest is to educate the colleagues that are coming behind, and develop their interest to become surgeons, in the future, but at the same time, keeping the surgeons who are already qualified up to date, with what is happening in the surgical practice, to keep excellent surgical outcomes. We are organizing our first ever scientific conference, from tomorrow, Friday at the 7th, up to Sunday, and it's actually a big academic
We'll come to that
activity. Thank you.
All right. We have consumed half of our time, and it will be good to take a little break, and then we come back. Viewer, this is Sundown Beam live on SSBC, and this evening we are joined by doctors, and those are Dr. Gift Natana, and he is the Vice President for the Association of Surgeons of South Sudan, ASOS. And we are also joined by Dr. Peter Thomas, the Secretary for Academic Affairs in ASOS. This evening we are trying to, explore the background of ASOS and all the activities that the surgeons of South Sudan are trying to do for serving lives of South Sudanese. Up to here, let's go for a short break, and when we come back, we will investigate more about the conference that is underway, and that is beginning on Friday. Let's go for a short break, and we'll be back shortly. Stay tuned. Welcome back from that short break, viewer. This is Sundown Beam, where we dissect the issues that matter to you. And this evening, we are with doctors from the Association of Surgeons of South Sudan, ASOS, to discuss about the visions and mission of ASAS, as well as evaluate the activities that this association has been carrying out, and what does it mean for South Sudanese. How many surgeons do we have in the country? And we had a challenging number. Welcome back as we continue into this conversation. Let's go to the conference that is underway. The conference, the scientific conference that ASAS is going to hold. Tell us brief about this conference, Dr. Thomas. Welcome.
Yeah, thank you. And thank you for the viewers. So the conference is starting tomorrow, Friday. That's the pre-conference, an official opening. It will be graced hopefully by the government officials, okay, from our National Minister of Health and plus other partners and surgeons and other professional associations as well are invited, plus other stakeholders. We are also very grateful that this conference is actually being supported by a couple of entities, including ICRC, CBM, and Cooperative Bank, and a few others. So the first day is going to be briefly the official opening and a few presentations. The second day is going to be purely scientific presentations, surgeons presenting the research results of what they have seen here, including case reports of rare surgical cases that they have encountered. The last day is going to be also have scientific, and then after lunch we'll have our annual general meeting for a new executive to be elected into office.
Thank you. So there is a transition of power that is going to take place. Dr. Gift, talking about the conference, scientific conference, what is there for a South Sudanese citizen?
The students will be there to discuss and showcase research and scientific endeavors during the last year. So in this conference, where we are talking today to the people of South Sudan, we are trying to engage also the people of South Sudan to know about what is happening in the surgical field, how far the surgical field has advanced or come in South Sudan. For the nation, it's a big achievement, because this is the first time a scientific conference is happening for particularly discussing surgery or surgical issues. Scientific conferences are very important because they develop the profession. They develop the surgical profession in South Sudan, and also bring together all those who are concerned to come and deliberate about the issues of surgery, taking into consideration where the world is now, and we see where we are as South Sudanese, and also come up with evidence-based examples of our practice, because in medicine is something not only in books, because yes, you teach people the standards in books, but then it may differ according to the country, according to the setting. That is why through the conference we are coming to discuss and deliberate and see whether the practice that we are doing here is serving our people or been happening before. Mm-hmm. But now the platform is there, and hopefully we've been happening before. Mm-hmm. But now the platform is there, and hopefully with we as association, we are committed to make it an annual. We as association, we are committed to make it an annual scientific the program, so that as a propellant for the others, like we are going to discuss research topics. Mm-hmm. Research is one of the most important area whereby people develop. You cannot develop without research. So now this platform will be there to evaluate what we have been doing for the last year. And then we set goals for the upcoming year. We encourage our professionals, our doctors, establish specialists, and those even students to explore into these areas, because we cannot explore into these areas, because we cannot currently there are challenges in carrying out research. So together we put our efforts, we put our brains together, so that we see that now how we can be able to go in the next year.
Thank
so
you.
there are enormous benefits to professionals, also for us as a nation, for conducting such a scientific conference.
You are trying to say that this conference will enhance the service deliveries to the citizen?
Yes, at the end, because when we come and discuss, it will enhance the service delivery, because when the surgeons gather, they will discuss by standards.
Thank you.
Let me add just a few to what he has said, and to answer your question about how the public is going to benefit from this conference. Maybe it's going to be very important also for us, although access to the scientific conference is just for professionals, but it's good for your viewers and the public to know what are the topics that are being discussed. Like I said, the first day is the official opening, where our dignitaries are going to be there. Okay, but of note, I mean, we are going to have 3 presentations. The key presentation is going to be actually about the burden of surgical disease in South Sudan, how surgical diseases are affecting our public, what are the main surgical diseases that are available.
That's actually my next question, Doctor.
The second presentation is going to be on the postgraduate medical training in South Sudan. And the third one is going to talk about the future of minimally invasive surgery in South Sudan. So apart from that, over the coming few days, research presentations, but a bulk of it is actually devoted towards talking about trauma. And we know the magnitude, the impact of trauma in our country. So in summary,
that drives us to the question that you touched, the question of the surgical cases that have been registered, through your experience in hospital, be it a public or private. There might be common when you come as doctors to compare the notes. There is somewhere where you see there are some indicators that this surgical diseases or this surgical disease is increasing or dropping. So what are the common surgical cases you register if you can evaluate? Doctor, you can.
Okay, I believe this question is in place, but from our discussion from beginning, yes, I said, when we are speaking about surgery in South Sudan, we are speaking about different disciplines. We need to explain to the viewers also that, surgery is not one discipline.
Yes.
There are general surgery, those who deal with general body. There are orthopedic surgeons, those who deal only with bones. There are ENT, those who deal only with ears. Ophthalmic surgeons with eye. Maxillofacial, like me, I am a maxillofacial surgery. Plastic surgeons. So these are all different disciplines within surgery, and others, neurosurgery of disease, that we need to sit down in this conference and then see. Like, in general surgery, what are the most common surgeries, conditions, which may be for South Sudan? Because, sometimes it may differ from Uganda, from any other part of the world. So as we sit in this conference, the scholars, the professionals, the surgeons, they will present, like he said, their findings. Then the citizens, or later on their recommendations will come out from the conference, and then we see in the general surgery, these are the most common conditions that, South Sudanese suffer from. So it is going to be, diverse. We cannot say it all
Right.
at this time, yes.
Yes, maybe Dr. Peter can say something about.
Yeah, well, nothing much to add, but most importantly, we just need to know that surgery is a broad specialty. It's not one thing. And also, you see the demographics of our country also is changing. It's like in the past, most of our population used to be in the rural
Areas.
settings and areas. So we never knew what diseases that were affecting them, okay, and why are they dying, maybe potentially from surgical diseases. Now coming to town and having access to a surgical expertise, okay, will help them first get to know that they have a surgical disease, and also will help us as professionals to know that in South Sudan actually we have this pattern of surgical diseases. But like he said, surgery is a broad specialty. You have people who deal with kidneys, for example. You have people who deal with heart, people who deal with lungs. You have people who deal with bones and muscles. And this first ever scientific conference also is actually a platform through which national surgeons do present the results of the research, because that will help us even go outside the country and let other people also learn from us, okay, because the diseases that are here in South Sudan may not be available, may not be somewhere else, or there may be very few somewhere else. So us having a big number of certain pattern of surgical disease will help us actually, as South Sudanese surgeons, to have more knowledge and skills, okay, to share with the outside world. So we are happy that we are hosting the first ever scientific conference. It's a platform for us to engage and share and learn from each other.
Thank you. As we wind up, because our time is really running very fast, we will evaluate the challenges that are facing the surgeons in the country. So, what would you say as the main challenges that are facing surgeons as leaders of association?
Yeah, regarding the challenges that are facing surgical practice generally, because not only the surgeons as a human resource component of the surgical practice, but also generally surgical practice is faced with a lot of challenges. First of all, we don't have local training. The only or large scale, like you mentioned in the beginning, the numbers are few. We thank God that indeed this number is there to start something, doing something. This far that we have come, we appreciate the efforts of all those who have made it possible for this number to be like this. But then there's still a big gap, because currently all of this, or majority of these 110 plus, they are trained outside of the country. But because they chose to come back and save their people. So one challenge in the area is that we don't have local training that is effective. We have a College of Surgeons and Physicians that is in Juba Teaching Hospital under Ministry of Health. CPS is called CPS. This is training local surgeons, but the scale is is still limited. And that is why with time we need to develop the body so that we domesticate training. Because if the training is domesticated or is local, that means the number will be larger, because we cannot as a country be able to afford to send many people outside. It is expensive to train many people outside, and also it drains our effort somehow, like Dr. Peter mentioned in the beginning. So we need to expand, support local training, and then also if we go to the other challenges, like the surgeons, when they come back from
Hayato Mama